All right, what's going on? What is going on? Happy Monday, happy Monday, happy Monday. I know that don't sound right, but I always look forward to Mondays, and I'm not lying, y'all. I promise I ain't lying. I always look forward to Mondays because of our Monday Night Live shows, and we have a special show for y'all today. Now, y'all know me, my homie Vanna. Shout out to her. And we have other special guests. We always be talking about the foolery happening in local government on the city side and in the county side, to be continued about that, because it's more than enough content for us to pick that up the next couple of weeks. But this week it is very special show because we are talking about issues around Medicaid re-enrollment, specifically in our lovely state of Missouri. We are kind of jumping off this week because we also have our event on Thursday as well. But we really want to spread awareness about this really important topic. And y'all know, Kelly, I know some things. I don't know everything, y'all. I don't know everything. But I'm smart enough to realize and recognize when I don't know about some stuff, I talk to people that do know. I talk to the experts. And so I am super, super, super excited to have on our platform. Y'all ready for this? Y'all ready? We have Mr. Derrick Melton from CareSTL Health. Welcome, welcome, welcome.
Oh wow, what's going on, Kelly and audience? I was first to say I want to clarify a few things. So you made me a little nervous when you said expert, but I'm gonna do the best that I can.
No, no, I read your bio, okay? Because I
Uh,
tried.
yeah. And the next thing is your backdrop is amazing. So I'm still new to St. Louis. I need wall art. So as soon as we get off the call, I gotta go find some stuff. You know,
you you are good. And where you from?
I'm from Mississippi, born and raised Mississippi.
Man, I hear that draw. I hear that draw. We a little country. People say we country here, but no, that I hear that
You
draw.
hear it? Okay, I own it though. I own it. I own
You should.
it.
So, welcome again to the Monday Night Live platform. Again, I'm really excited. Obviously, we got a very important and heavy topic to discuss. But before we get into it, please introduce yourself to the people about who you are, and really what brought you into this profession.
Yeah. So again, thanks again for having me on the show. I'm Derrick Melton, born and raised, as I said, from Jackson, Mississippi. I'm a husband, father of three kids, and I'm the chief operating officer at CareSTL Health. CareSTL Health is a great FQHC in North St. Louis. We provide specialty services, primary care, OBGYN, women's health, you name it, we essentially do it there. But I think the most important thing is we provide services for the uninsured, the underinsured, the Medicaid, the Medicare population, and the self-pay. Really what brought me into healthcare, like I never really dreamed of being a doctor or, being a nurse or anything like that. But I did have and essentially a skill that, that I want to make a difference. And for me, it's from the administration and the leadership perspective. So I enjoy what I do. I don't think that, there's this thing in healthcare to where people are really trying to paint the picture of something that it's not, and people are really losing the touch of what in terms of what it's designed to do and what it's designed for. So for me, it's just really getting back into the seat, working for a community health center, and just being able to help provide services to individuals that really need the services. Not saying that people don't need healthcare, because I think everybody needs it, but let's just be real. There's a specific set of people that needs it. I don't want to say more than others, but more than others, right? So that's what I do. That's where I am, and that was just a little bit about CareSTL Health.
Thank you for setting that stage for us. I did have a question.
Mhm.
I know what an FQHC is, but for the people that aren't aware, can you explain what that is?
Yeah, so it's a federally qualified health center, and essentially what that is that they're federally run, and we receive federally dollars from the government to be able to provide services that otherwise the people couldn't go and get. Now, I know we'll get into it into the later into the conversation, but you have these a lot of major hospitals across the country, even in St. Louis, right, that just don't take a specific service. When if you look at Medicaid, self-insured, those type of things, well, we do. And people always say, well, where do those patients go? They come to us, we take care of them. So essentially, that's where they were designed to do. I'm from Mississippi, so if you can just think about Mississippi being the poorest state in the country, and we have our own separate sets of challenges. Now, I always tell people, Kelly, when they talk about Missouri, I was like, it's okay. Missouri's doing fine. Just imagine coming from Mississippi with this times 10. So not to get into that, that's a whole nother conversation, but that's what the FQAC space is for. I do think that we do a great job, but we're not really unique into anything that any other FQACs, the community health centers across the state of the country, what they do. We're all here for the same thing, and we try to do our best to do great work for our patients that we serve.
Oh, thank you for breaking that down, and by literally telling people, when folks aren't seen because of whatever coverage they have, or even if they don't have coverage,
Right.
that's where folks go. Folks go to the FQHCs. And dang, you really, Mississippi. Love my Mississippi fam. I got family from there somewhere. Okay. But yeah, them statistics.
It's
Lord help us. So okay, I know you spoke a bit about CareSTL Health, and like the different services and things that they provide. So can you speak a little bit about kind of like what the services provide, like where y'all located, and also like what is your role? Like what do you do there?
Yeah, so I am the chief operating officer. So anything dealing with operations, from the brick and mortar perspective, out in the community, I have really gotten into like the government role in terms of being able to get funding across the board, being able to work with politicians, different type of government affected leaders to be able to help push our centers forward, rather if it's adding programs or adding buildings, like those type of things. We do have our latest project is that I'm working on now, along with the rest of the staff, and this charge is being led by our Chief Executive Officer, Angela Claiborne. Is our new wellness center. It's about a $30 million facility that's going to come into North St. Louis, and right, exactly, and really just do great things and provide different services for our patients. We look at healthcare from a clinical, holistic standpoint, and that's what we bring. And then across the street from that, in addition to that, is we will have 2 60-unit affordable housing units for senior citizens to come in and live. So it's bigger than healthcare. It's bigger than coming in and getting your blood pressure checked and like those type of things. We are creating this essentially a wellness campus for not only for people to come and get their healthcare, but somewhere for people to come and enjoy as well. So looking forward to that. My day-to-day, it changes. So, what does that mean? It changes. I think when you think about operations, it's a broad picture. One day, we're talking about security, patient flow, having a footprint into the community, engagement speaking. And I think that's one point of it. But, the biggest thing is where can we, or I can insert myself in the things that I've been taught to make it better for the patient. And that's what I enjoy. I enjoy making things right for the patients. I enjoy making it easy for the patients. Coming from Mississippi, there are a few different type of healthcare systems to finagle through, and it's tough. I have grandparents, I have a mother, and then even myself, it's tough going to the doctor, right? You get to these big buildings, parking is terrible. These signs are hanging everywhere, and it's just tough. So part of my job is, what can I do to make the patient experience better, to make the patient feel wanted, make them feel welcome, make it easy to get in, get out, and like those type of things. And I think your last question is, where are we located? We're located in North St. Louis. We do have 5 different locations, in which we can always go to our website, CareSTLHealth.org, to find out exactly where those addresses are. But our main clinic is off of Martin Luther King in North St. Louis. So hope that answered, or give a small backdrop of what I do and where we are.
It really did. And something I want to lift up, which I don't think I've really ever heard this in speaking to folks in the healthcare space. You said literally you center the needs of the patients and you figure out how can we make that experience better. Oh my God. You how you responded to that, you need to respond. I don't know, did you practice that? Like,
No, I can't practice.
I love that. I love that because I think that is one of the reasons why when we're talking about not only just Black people having access to quality healthcare, but again, that the whole experience. And sometimes we feel like we're not being treated like people.
Hmm.
And so for you to say that, I just think that is so dope, especially when we're talking about um, an FQHC, a Federal
Hmm.
Qualified Health Center,
Hmm.
where sometimes people may not be treated with dignity. You know what I mean? So I really appreciate what you said. That was beautiful. Like, again, I hope you can watch the replay. But how you broke that down, that was dope. So I know we spoke to, again, your role. You're kind of a big picture, right?
Hmm. Hmm.
Person. So can you speak to the issue of healthcare access in our region and why should we care? Like why should we trip off of it?
Yeah, I mean, so caring about it is we just should, right? It's the right thing to do. We should all treat people like humans. We should all treat people with respect and dignity, for whatever that's worth. And that's kind of outside of the medical part, right? But one thing that I noticed coming into North St. Louis, if you come off of now, let me get my bearings right, off of Kings Highway, passing Barnes, it becomes a healthcare desert. And what I mean by that is there's not a whole lot of resources from a clinical standpoint for the individuals that are in North St. Louis and those areas to receive care. And then in addition to that is there's there's also a food desert, right? There's a food place on a fast food restaurant on every corner. But when we talk about healthy living and those type of things, it just continues to have this rolling cycle, right? To where we are just creating unhealthy human beings. So why should we matter is because, that is the upbringing of a lot of individuals. Some people, they do better when they know better. So, in addition to us just being healthcare providers, it's our job to educate the community, to educate the community on healthy living. It's our job to partner with local food banks and partner with local, really, restaurants to able to bring business to the North St. Louis market. It's our job to not just educate the patient when they're in an exam room, but also educate the patients when they're feeling well. There's a big thing of for in the African American space, we go to the doctor when we're sick, but it's bigger than that. Especially for males, we have to go to the doctor so we don't get sick, and it's just understanding that piece, and then again, just being able to educate the community and just doing the right thing by people. I think is huge. So it's probably a blah answer, but at the end of
No.
the day, it's what it is.
No, but that's real when you think about the north side. So uh I grew up on the west side, and then my family moved us to the north side. So just a few blocks south of Natural Bridge and Kings Highway.
Hmm.
So again, I'm just thinking of like, yeah, to your point, there's nothing around there. Again, you on Kings Highway,
Hmm.
you see the cranes when we're talking about
Yep.
JC and them. Shout out to them, okay. But like, I mean, aside from that, there aren't any options.
Yep.
If any, very few,
Yep.
if any. And that's very challenging, especially like you said, you brought
Yeah.
prevention.
Right.
Prevention.
Right, right. And in addition to that is you got to think too, some people opt not to go to the doctor because they can't finagle through different health centers, right? The bright lights just scare them. They don't want to deal with the parking. And then in addition to that is it's bad to say, but when we're dealing with the poverty line of the individuals in the North St. Louis, when you're talking about self-insured, Medicaid, Medicare, the underinsured, because there's a difference between having insurance and then just being underinsured, and those type of things is that let's just be real. A lot of the big healthcare centers they don't accept those policies. And if they do, it's on a limited panel version. So as an example, when you think about the whole North Side, where do those patients go? Especially when, you know, the nuances of Medicaid in terms of the prior authorizations to be able to get into those different healthcare centers is just very robust. And it's just, I mean, it is what it is. You can come down the street, you can see us. We have different type of services to where we meet the patients where they are. We partner with Uber, we have vans, Medicaid transportation, the whole 9 yards. So we really make it easy for you to come see us. But it's our jobs, again, just to reach out to the patients to make sure that they get into the system.
That's really cool that you all have those partnerships to work with people, because that is a huge barrier, just the navigations of that.
Yep.
Really quick,
Yep.
can you explain, because you mentioned the underinsured, can you explain what that means?
Yeah, so obviously, no insurance is what it is, right? We don't have insurance, and then Medicaid is obviously a government insurance that, you know, individuals, they go through the process in terms of getting eligible, re-enroll, or those type of things, and we'll talk about that later on in the show as well. But a lot of people, what they lose sight of is the underinsured. And I know this was a huge deal when Obama was in election, and when they was talking about Obamacare, different entities choose not to take that insurance type. But on top of that is, you know, if you think about it, a couple years ago, people were getting fined for not having insurance. So they were just going to get in a policy. But at the end of the day, when you look at those policies, and sometimes those policies were like, man, astronomical, just the co-pays on them was just crazy, to where you're just really just checking the box. So at the end of the day, you don't have insurance. Because for me, if I have to go to the doctor for a runny nose and then the person in the front tell me that I have to pay $3,000 before I get seen, that's not insurance. Because I'm going home. I'm going home. And I know we're shining light on it today, but the reality of it is the example I just gave you is true. And so in a nutshell, without the example, that's essentially what the underinsured is for. You to get these policies to where it pays pennies on a dollar, and you are responsible to come out of pocket with the rest of the funds, et cetera, et cetera. So it's almost like not having insurance altogether, because if the person can't afford the additional payments, then what do? They do nothing, and they just don't go.
That's real. For real. So that was a really great example, because that's so true, unfortunately.
Yeah.
That's so real. And so I don't know, you know, this is just flowing so well. This is like the perfect segue to talking about, because you mentioned kind of like the different levels when we're talking about levels of insurance and the types of insurance. So Medicaid. So can you explain what is Medicaid, as well as like what role does it play in serving vulnerable populations?
Yeah. So Medicaid in general, it's a government insurance or payer that individuals are able to qualify for if they meet certain criteria. How many people stay in your household? How much money you make? How many kids do you have? How many, you know, where do you live? Like those type of things. And that's what qualifies you for the program. So there is a federal guideline, essentially a pay scale and like a questionnaire, those type of things you have to go through. And then it kind of goes through this system, and then it kicks back an answer like, okay, based on the information that you have given, yes, you qualify, or no, you don't. Right. So that's kind of the process. Essentially, what it is that from a government perspective, it's an insurance that the country has allowed for us to use to insure people that, again, for the for individuals that's under the poverty line, for people that don't make, you know, a whole lot of money, that just can't really just afford the other private payer insurances that they have. So this is kind of not so much as a safety plan, but it's it is an additional plan that people can get based off those criteria that I explained.
And are there any, like, I know obviously there are those income requirements that folks have to meet to be able to utilize these benefits, but are there any other, like, I don't know, populations that you have seen that like really maybe utilize Medicaid?
Yeah, so it's weird. I will say in Missouri and in North St. Louis, particularly. I know our African American or Black, however people identify themselves with, is very high. I think we're at about 95, 98% of African American Black people that really uses our services at our health center that has that payer source. One thing that I did find, though, for the state of Missouri is that I found that 35% of non-elderly Medicaid enrollers in the state of Missouri are people of color. So that is a little bit under 15% under half of the state for people that are on Medicaid.
Wait, can you run it back? Can you run that back real quick, please?
35% of non-elderly Medicaid enrollees in Missouri are people of color. So I'm just gonna let that sit right there.
Y'all heard it. Y'all heard it here.
Yeah. So, and I'm sorry, what was the second part of your question?
No, that was great. Because sometimes people forget our state
Mm-hmm.
and the demographic, like what the populations is given.
Yep.
Okay.
Yep. So, and I think that's real. It's important not to get on and say, yeah, I mean, this is particular for Black people, or for this type of race or that type of race. But I do think of when we think about the criteria of what qualifies you for Medicaid, I think it gets a little deeper, right? If you're talking about income size, if you're talking about income, you're talking about household size, you're talking about those different type of things in which will enroll you into the program. The question really remains is, how did you get there? How did we get there? And what I mean by that is, how did we or the state fail the individual?
Man, that's deep, but that's again, that's real.
Yeah. Sad to say, it's a lot of, especially Medicaid, it doesn't go on like who's the sickest, who's the well patient. It goes on those criteria. So if those are the criteria and 35% of the people that I just said are people of color, then it lets you know the depth and the makeup of the community and the state as a whole. So, again, what is the other 65, 70 individuals like? What are they doing? Where do they work? I'll just call it for what it is, Kelly. What do they do? What are they doing with their lives? Or what do they do different with their lives? Or maybe nothing happened. This is just kind of how the chips laid.
So I'm gonna put that on the parking lot, because that's a whole other show right there.
I'm sorry.
No, you're good. This is great. But again, I just like this conversation because, again, sometimes people think, oh, healthcare access, like it's in this one little section or this silo. But it's related to all the other issues and the things that we talk about on our show, what people speak to in their communities about just having thriving people and being well. This is one aspect of it, but it's connected to so many other things in our lives.
Right.
So I like this because this, again, is shining a light on how related that this is when we're talking about our communities and even looking bigger picture, our region, and even bigger picture, our state. So it says a lot. Okay, so 2020, right? 2020 was trash. My entire sense of time, it has been lost because of 2020. Like, for real. Like, it's and COVID, obviously, it impacted everyone, not just me, but it impacted the world. We had the pandemic, but I want to add, concerning Medicaid, it turned out to be an interesting, somewhat of a decent year. So this is why I say that. So we had the federal public health emergency. It was issued due to COVID, and we voted to expand Medicaid. I was so happy that because that was a long time coming.
Right.
And we did it convincingly. Like, it wasn't even like a little margin. Like, we voted, the people spoke, and we approved that joint. So I guess my question to you is, like, how did these things positively impact our state's Medicaid system?
So it affected it in so many different ways. From a positive perspective, I will say that the government and the state really got it right. And what I mean by that is it's kind of like the student loan debt relief program when Biden said, you know what, time out. If you're on something, we're not going to pay. We'll just keep pushing the guidelines back or the dates back. And then finally, when you have to re-enroll into the programs, we'll pick it back up later. But right now, don't worry about that. So with Medicaid, if you think about everything that I said earlier in the show, of what makes you qualify for the program, the government did the same thing. They said, okay, time out. If you are already into this program, then we're just going to continue to keep you enrolled into the program. We're just going to keep you there. We're going to hold everything steady and consistent, and just, due to the lack of workers, those type of things, to where, we just can't get out in the community the way we were doing pre-pandemic. We're just going to assume that nothing's changed. In fact, things may have gotten worse. And the last thing that we don't want to do is take healthcare insurance. So they really got it right with that. And I applaud the government for doing that. Now, in terms of what we could have done better, and a lot of people don't see, are the people that lost their jobs, right? And the people that maybe was waiting on an application, or the people that had life-changing events. Because think back to 2020, we were furloughing like crazy. People were, they were getting sick. People needed 2 or 3 different type of plans just to cover whatever it is they were going through in their life, not just from a COVID perspective, but from mental health, behavioral health, like those type of things. And to your point, like, it was a huge issue. It was a very big issue, things obviously that we'd never seen before. But what a lot of people don't know is that the Medicaid system itself didn't come bulletproof from everything. So everything that I just named, people are getting furloughed at the division of Medicaid, right? How the state, or how any other state signs patients up is it's face to face. I mean, you can come down to the building, you sit across the chairs, you fill out the application, you walk you through, you bring in check stubs, you bring in proof of income, like those type of things, the face to face contact. Well, Kelly, how do you do that now via Zoom? How do you do that over the phone when a lot of the patients don't have telephones? How do you send mail to people's houses when you have incorrect addresses, or they change month by month? They're just changing homes. So now we have to think about ways to do it differently. Especially when you look at the whole Medicaid office, essentially, probably not the whole, but a portion of it, they were furloughed, they were let go. I mean, they were faced with cuts just like everybody else. So now you have this system that people need. I mean, this service that people need. It's in this system that we were going through pre-pandemic, and it's what we talk about operations, right? And now that particular service is affecting people because we're in the middle of a pandemic. So that was huge. And I think there are things that we could have done better. I think the government as a whole, not even particular to just Missouri, I think from what I hear, they did a decent job. I moved to Missouri in the middle of the pandemic, so I can only speak for the past year and a half or so, or ish. But I think for the most part, they did a good job. But we failed a lot of people. And when I say we, I mean the government, the government as a whole. We failed a lot of people. A lot of people had lapse of services. A lot of people didn't receive the type of healthcare they need. Family members got sick, for them to figure out that they didn't have insurance when they got to the hospital. I mean, so what do you do? And it was based off those principles that I just explained. So again, I think the question was, how did this come out to be a positive? It came out to be a positive in a lot of different ways. We were able to let people maintain their eligibility until we just kind of figured it out. But there were also other things going on in the background. I don't mean to be Debbie Downer, but I mean, I'm just going to tell it like it is.
No, I appreciate you painting the full picture, again, coming from that operation standpoint, and how, again, like, these things don't happen in like vacuums or in silos. So the pandemic, I mean, it had clearly it impacted everything, every sector, every corner of the world, especially thinking about folks being furloughed, all that stuff that clearly happened with people that were part of and spearheading and leading and working in that process.
Right.
So I really appreciate you lifting that up, because we don't think about that.
Yeah.
We don't think about that part of it. We think about, obviously, you know, I'm trying to sign up, I'm trying to get my services, which that's
Mhm.
that. I get it. However, again, like there's a process, right? There's
Right,
a
right.
whole process that we may not be privy to.
Right. And again, one thing, kudos to Angela Claiborne, our CEO. I mean, she was all in the middle of it. We found out that, you know, the department, the division of Medicaid were furloughed. She was like, don't worry about it. We'll train our own people to do it. Right. And she was like, well, no, you can't do that. It's this, that, and the other. She's like, well, give us access to the system. We'll just push it through for you. And it's like, well, it's a financial issue. Don't worry about it. We'll pay for it. So finally, you know, we started pushing these envelopes, and that's where the presumptive eligibility came available. And presumptive eligibility was huge, especially within this past, I would say, 12 months, 6 months particularly, because the makeup for presumptive eligibility is essentially for pregnant women and kids. And so basically in the state of Missouri, or even in the country, if you are pregnant and you don't have insurance, you're out, that's an automatically enrolled. Like you can show me what you can show me, but you're enrolled through the course of your pregnancy, and brand new newborn kids, obviously for the first, I think it's year or so for the first of life until anything crazy happens or whatnot, they're enrolled as well. So it's to make sure that mom and baby are at least taken care of. But about a couple of months, maybe about 8, 9 months ago, that a system and that approach, it rolled out to all individuals. So what Medicaid did, they allowed us, and they came in, they trained, we did some training different modules to be able to register everybody that really just needed the service of Medicaid. So we were just like, hey, if you need, hey, just come on in, we'll sign you up, right? We'll at least get the ball rolling. And, you know, this is something that everybody should take advantage of, which again, when you talk about the positives that came out of it, kudos to the government, because a lot of people don't know that. We did our best as a health center to put things out there, to have outreach events, to have social media blasts, et cetera, et cetera. And we did the best that we could. And obviously, you know, in my seat, we could always do better. At least I always look at myself in the mirror to say that. But you know, it was something that I think that the community, they did take advantage of, and we all saw the fruits of the labor.
I love that.
Mm-hmm.
I love that. So again, something positive that came from that was, again, from what I'm hearing, is just even more engagement
Yep.
with letting people know, hey, you have this access. Come on, we got you. Come through.
Yep.
We can kick this process off for you. And that wouldn't have happened
Right.
just because of this unique situation and circumstance.
Yeah.
So,
Yeah.
all right, now we know, right? This wasn't gonna happen. This wasn't gonna last forever, right?
Right.
It was just temporary.
Yep.
So I know that was a deep sigh. You know, I know we were everyone, you know, the streets was talking, everyone was saying, oh, this public health emergency is gonna end in May or whatever. And then you know, Uncle Joe Biden, he signed this resolution basically ending it like damn near a month before everyone was expecting it to expire. Again, we knew it wasn't gonna be you know, be a permanent thing. But I guess so my question to you is like, what are the consequences, right? Of, I mean, again, because this is it, like it's a wrap, basically. So what are some of the consequences specific to Medicaid? I mean, it's a lot of consequences, but specific to Medicaid.
Yeah. To your point, there's a lot of consequences. The reality of it is that a lot of people are going to go uninsured. And we, from a community health center perspective, we are literally, Kelly, literally trying to touch every single individual that we can to make sure that they have the resources that they need, and to make sure that we're giving them a best shot to be able to not just live a healthy life, but live the lives that they deserve to live. This emergency, we're still about 2 weeks, a couple weeks into, you know, basically the presumptive eligibility piece, and then the re-enrollment process that we talked about. So not a whole lot of public data out there to say, okay, what is the impact? Now, for me, my brain, I want to get with the state and track that week over week. Like, I want to know. I mean, I want to track it week over week, not just for North St. Louis, but for the state as a whole. for several different reasons. Because for us, again, at the community health center level, we don't look at things from a broad perspective. That one patient is that one patient. And we are literally trying to attempt to save lives every day. Now, what is the huge impact? I wish I had a crystal ball. I wish I could say there would be very little to no impact, but I did pull some things that are interesting, and I apologize because I'm going to read from a script. But I will say, so what I have based off our census report, there's a little bit over 1.2 million individuals enrolled into Medicaid as of October 2022. 31% of Missouri population is low income. 15% of Missouri population is covered by Medicaid and CHIPS. In Missouri, Medicaid covers 1 in 11 adults ages 19 to 64, 1 in 3 children, 2 in 3 nursing home residents, 1 in 7 Medicare beneficiaries, and 2 out of 7 people with disabilities. So here's another kicker part, and this is what I said earlier. 35% of non-elderly Medicaid enrollees in Missouri are people of color, and 49% of adults in Missouri, hold your breath on this one, that are on Medicaid, these are working individuals. So I'm going to say that again. 49% of adults in Missouri on Medicaid are working. And last, 39% of births in Missouri were covered under Medicaid. So we have talking about our kids. 39% of those kids that we talked about, they're being born, they're depending on this service. So if they're depending on it, chances are who else is depending on it? Mom is depending on it. And then the next question comes about when we look at that 49% of adults that are on Medicaid, and these are working adults, I'm thinking minimum wage, we need to increase it because, again, the federal guidelines set the pay scale and they set the criteria, and they set the poverty line. So you mean to tell me we're working 40 hours a week or whatever the case may be, and we still qualify for this service? That lets you know, not just as a state, but as a country, we have to do something different.
Sorry, I did a woo over here. Wow. Again, to your point of what you said earlier about, again, looking to see like who is utilizing Medicaid, right? It's not what people assume.
Right. You know, it's not where people just, I don't want to go to work. I'm just going to sit around and do nothing, and I'm just going to live off the system. No, it's those are the numbers, right? I mean, it's 49% of the people that are on Medicaid, they work. They actually have a job. I mean, they go to work every day just like you and I, and they just can't afford health services for themselves or for the family members or, their loved ones or their people that take, their caregivers. They're bigger than just being mother, fathers, or whatever. I mean, these are, in addition to that, these are second, third generation families that are all staying together with 1 or 2 people in the household that work. But now you're taking care of mom, you're taking care of your grandparents, you're taking care of your spouse, your 2 or 3 children. I mean, this again, so when we paint this picture about people, just living off of government assistance, that's definitely false.
I be having conversations. All right, real quick. Hop into Kelly, real life moment. I have so many conversations with so many different types of people, including some of our elders.
Mm-hmm.
I want to say these people, they just sitting around, they milking the system, and they ain't want to do nothing, they ain't working, and they ain't. Pause.
Right.
Pause. It's not the case. Think about, like, I mean, my grandmother's talking about, I remember when a White Castle was a nickel. Okay. That's great, Granny. But that ain't the case now. And she knows and on a fixed income. These prices, it's insane. And with inflation, everything is getting more expensive.
Yep.
So to your point, if our minimum wage, if that ain't changing, as the young people say, the math ain't mathing.
Math ain't mathing.
That's the problem. That's okay. Let me stop, Kelly. Get back.
No, this is good.
It's more than, it's so much bigger. It is such a bigger issue than that. It's really, again, why are folks needing to utilize these safety net services? That's the question.
Mm-hmm. Mm-hmm. So,
and the data points to it. You have the receipts. The data shows this. And I mean, I know we're talking about Medicaid, but this is similar to a lot of other safety net programs out here. People feel like folks just want to just be sitting up here. No. Now you may have a couple of extremes. I always tell
there's an exception to the rule.
But you know, most of us are in the middle. You know, I like to believe that people that utilize these resources, a vast majority of them need those resources. So, and we have them. So let's help our people. And also, again, address the root cause of the issue, because the root cause is that the math ain't mathin'.
Math ain't math. I love it.
All right. So can you break down? So let's say that I use Medicaid, right? I know this is coming up. I need to make sure that I don't get kicked off the roll. So can you kind of speak to folks, kind of walk through that process? What does that re-enrollment, what does that look like?
Yeah, so as a plug, real quick, if you have any questions, you can always come to or call CareSTL Health. We have a great population health team and an outreach team that can help anybody, rather if you're on our patient panel or not, kind of finagle through the system. You can always come in and visit. We'll facilitate you and help you with the enrollment process. We'll help you with the paperwork process. And we will literally, I'll say it again, literally hold your hand and walk you through what that looks like from front to end. There's a lot of information for self-reading that's on the internet. And again, another plug, you can go to carestlhealth.org and click on one of our links. We have a frequently asked question session, as well as how you can enroll, and et cetera, et cetera. But the biggest thing is, I would say, for individuals that are already into the program, is to make sure that your contact information, your phone number, the biggest thing is your address. I have been, at these past 2 weeks, I've heard horror stories about address changes and what the division is doing in terms of sending mail to people's houses. I'm hearing that it's coming. Again, this is totally rumor. I know we're live, but I'm hearing that some mail is coming looking like bulk mail, like just a name on it, nothing. Just so what you're gonna do, Kelly? You're gonna rip it up and throw it in the garbage, right? So make sure that you're opening mail, making sure that you are taking ownership of your own healthcare, and you're just calling to get information. Maybe you enroll, maybe it's time to enroll. A call is always good. It doesn't hurt. And again, like I alluded to earlier, make sure that your contact information is, because they will call, they will kind of get the ball rolling into that. And if you have any type of, I know it's, like you said, Kelly, it's a blur to think about where we were in 2020 or 19. But if you had any type of address changes, making sure that you are calling and getting those things cleared up. Not saying that, okay, well, I thought that I did this, or that I changed and maybe they have it. I encourage people to call to make sure, trust and verify. They're calling to make sure. And I think with those things, partnering, with these type of shows, going on the internet, doing self-learning, updating information, email address as well, but address, telephone number, like those type of things. I think for the most part, people should be pretty square. And then again, they can always come to us or go to other community health centers. Again, we like to say that we do things great, but the reality of it is we're not any unique than any other FQAC. Like, it's a lot of people do a lot of great things for the communities.
Shout out to that. Y'all heard all of that. So make sure you go ahead and access those resources. I also have to plug for my people out there on the internet. We are also partnering with the St. Louis Integrated Health Network, the city health department, and other folks to host an event at a snazzy place. Just come to check out this event space, because it is, I literally, when I saw it, I gasped.
Yeah.
Shout out to the St. Louis Integrated Health Network, and well, shout out to him, because that's the only way we would be.
I know, right?
Okay. Yeah. But come out, y'all. We will again, engage in this conversation as well. We'll have some one-pager resources you can take with you and share with other people. And we will be having folks that can get folks re-enroll on the spot. You can check folks' status. So please, that is this Thursday. Doors open at 6. We're going to be feeding people too. We got gas cards.
There you go.
Other incentives. I mean, we have a lot. So I also did want to plug that too. But I'll be sure after this officially, once it posts, I'll be sure to go back to put the link to CareSTL Health, to CareSTL Health as well, so people can just click and refer back to that as well. So
absolutely.
I appreciate that. So, okay, now this is my question. I have all the questions.
Go ahead.
This is my question to you. We talked a little bit about this before we hopped on live, but obviously, the call to action, the immediate call to action, make sure that people, you know what I'm saying, they verify, right, their information, their contact information, so they can be sure that they are re-enrolled, right? So one, that's like on fire. That's what we need to do right now. However, now, pre-pandemic, the state of Missouri, I mean, we were blasted for having like one of the worst experiences, processes when it comes to Medicaid enrollment, and even like SNAP with, like, unfortunately, that's where we're at. So I guess my question to you is, beyond this, again, what we're on fire with now, but beyond that, like, how can we, are there ways that we could come together to kind of advocate for the bigger system to change? I don't know, like, what are some of your thoughts on that, if you can share them on our platform?
Definitely can share. Again, I wish I had a crystal ball, and I wish I had a way that I can just get everybody in the room and just, it's, Kelly, I promise you, healthcare is very complex, but it's complex because we make it complex. And so let me tell you, one thing that I did like about COVID is that, so I was at the University of Mississippi Medical Center right at the beginning of the pandemic. And anything that I had on my high level draft board that I wanted to do, it was immediately done because people had really no time to talk about it. It was just like, if you want to do it, do it. We're trying to do all of this over here. So in coming through a system like that, to where there's so many check boxes and so many nuances, it just makes it really, really difficult to finagle through. My biggest thing was, if we can move at a rapid pace at a place like that, things shouldn't be this difficult. So that's one thing that I want to take out of COVID. I was like, okay, now we're kind of settling down. Let's not get all these signature sheets, get flowing back around again. Let's make this easy. But I kind of said that to set a backdrop, is that point blank period, we have to make it easy for the patient. We have to make it easy for the customer. People will not do things just because they're so complex. So when you think about a 15-page or 10-page application to fill out, what really matters on that application, Kelly? Really, what really matters? What really matters on the application? So for me, is getting the powers that be, letting them rework the processes, letting you really work in and say, okay, if you had 5 or 6 different bullets, what really matters for the federal system? What do you need? And do that. Let's just start there. Let's just do that. The next thing is, let's look at really partnering with different type of organizations that are in healthcare, is outside of healthcare, and putting resources there. I know different places to where people go all the time. And not to kind of harp on the Walmarts and the Targets and the food, but when we're thinking about healthcare, think about it from an ATM standpoint. Like, how can people go that if you're out, hey, let me stop by here, let me go ahead and enter, et cetera, and just make this easy for the consumer, right? As a country, we tend to put the resources to what matters the most to us. And if healthcare is not high on that list, and this is in addition to Medicaid expanding and re-enrollment, if healthcare is not high on that list, we are really failing not only the citizens in which we live into our state, but the people throughout the country. Because I will say this, Missouri is just not the only state. I mean, we feel it, we see it because we live it every day, but this is going on throughout the other 49 states in our country as well. So I'm a big component, again, to let's do the right thing by the people. Let's start putting the healthcare and the needs of the patients and the consumer first. And let's just start there and see where that takes us.
Man, you are dropping gems. I mean, but even what you mentioned about meeting people where they are, right? Going where the people are, and just they're already there. So making it something that is just like part of the routine, like, you know what, let me go over here real quick. Again, at a space where they're already at or where they're already gonna go anyway.
Right.
Slide on over. And also, again, what you're saying, I'm picking this up, centering the patient.
Yep.
Centering the people, because we are people. So really centering that and thinking about like, okay, we don't need this 20-page thing. Like, how can we make it easier for folks? And also because y'all don't need all that information. I mean, like, really.
Right. Yeah, exactly.
What are some major what are the key pieces of information that everyone can agree on that they need from the state level to the federal level, and call it a day?
Yep.
But again, something else that and I say this too, COVID proved so much to us. It showed us we can do some stuff. If we prioritize that, and that is important to us, we gonna find a way. I mean, just like Black people, I tell people that all the time.
We're gonna find a way.
We are going to make a way out of no way. Okay, we're gonna make it happen when we need to, and we made a lot of things happen during COVID.
We shut the economy down in less than 48 hours. It had rules and policies, bylaws, the whole 9 yards. Got it approved.
Exactly. That part. So this isn't that. Yeah, it isn't. Yeah, that. It's pretty easy. I mean, to me, straightforward. It's not something that could not happen. It's not. Wow. And then there was something else I was gonna say, and then I lost it. But
so I guess another plug to say, meeting people where they are. We also offer school-based services. So we go into the school, we offer, medical, dental services, behavioral health services for kids in the school. And so for me, that's huge. And I'm gonna tell you the reason why it's huge. To your point, you're meeting not just the kids, but you're meeting the parents where they are. So think about the mom or the dad that has multiple kids. The kid gets sick at 11 o'clock at night, has to go to school, but you don't want to take him to the urgent care. You don't want to take him he or she to the ER, but you send the kid to school to do what? To go to the doctor. Think about the parent that gets off of work at late hours, late into the evening, and now you have to make that decision. Like, okay, I have other, priorities because other kids are in the household. I really don't have that time to take the kids to the doctor and do those type of things while, without dropping in these juggling balls, right? So that's why it's important for us to say, you know what, we'll alleviate that piece and we'll bring healthcare to the school districts. One thing that I heard back this summer from talking to one of the superintendents is that not only does a healthy kid makes a happy learner, but kids come to school, a lot of kids in our district come to school for three things. They come to school to learn, they come to school to eat, and to get healthcare. And if you take one of those things away, you are really dampering the core principles of what the school is met on. So when you talk about, what they're built on. So when you talk about meeting people where they are, that's just a classic example. And, in the words of you, Kelly, I'm here for it. It's something that's near and dear. The kids, they're innocent. We want to I can give you hundreds of stories to where, we have benefited different type of kids into those systems, rather if it's the little kid, his or her mouth just hurt. She doesn't understand why. You have cavities. Well, we have dental service. We have mobile units. We have those type of things. And, the difference to where a kid can go right upstairs and get those things done and then, come right back down, maybe not, go to class the rest of the day, but really get the services that they need. And then we follow back up with them. Parents don't have to bring you to the doctor. Those things are taken care of. It's kind of like a school has become a one-stop shop. I think that's huge important. So I just wanted to piggyback off what you
Yeah.
said, also add to it.
I appreciate you sharing that information, lifting that up. And something else, schools are a foundation of our communities. And also, they're trusted place. And so when you're thinking about utilizing healthcare services, people may not feel a certain type of way, or they may not feel uncomfortable, or because they know that's their baby school. They know
Right.
the people, they know the folks there. So it isn't as maybe off-putting or intimidating or as much of a barrier or a challenge, in addition to the ones you lifted up with
Right.
scheduling and everything. But people trust those folks.
Yep.
So it's a win-win. So all right. Okay, cool. So that is all the questions I really have for you. Did you want to lift anything up? Did you have a takeaway, or was there anything that you kind of wanted to leave people out there on the internet with before we close out?
Yeah. First of all, thank you for having me on this show. Not to be self-serving to get me into this platform, but to really have these type of topics hot on the agenda to be able to educate the community. And it doesn't stop here. And in fact, it starts here. There are hundreds and thousands of people that can articulate the data and can articulate what's going on around our country. And I just think that we just have to do a better job of not just lobbying and speaking on the behalf for ourselves, but speaking on behalf of our community, even though it may or may not directly affects us. We get so caught up into these whirlwinds to where it's like, okay, that don't apply to me. I'm not going to say nothing. But in the fact to where if it applies to everybody, and I think to where right is wrong. I mean, right is right, wrong is wrong, right? And if you see a place to where you can interject yourself and help, I think for as citizens and humans, we should be doing that. So again, first of all, just thank you for bringing this type of topic to this type of forum to be able to make the public aware. And again, we do have the IHN event that's coming up this week. So I really encourage all the people that they can to show up. We will have, us people, like, we like to eat, right? So we do have food. We will be educating the community. We will have a table there, CareSTL Health, to be able to sign patients up. And again, special thanks out to Andwelly Jolly. He's a fearless leader at the IHN. He's really doing a great job there. I support him in so many different ways. In fact, his organization, the IHN, is one of the organizations that he reached out and received a grant, additional funding for. So we could get more community health workers, get more outreach workers out in the community to be able to do the type of work that we're doing now. So again, kudos to him, kudos to his staff, kudos to the work that they're doing. And again, it doesn't stop there. In fact, it starts in those places as well. And then last, if anyone wants to reach out to me, I'm Derrick.Melton at CareSTLHealth.org. My phone number is 314-367-5820. Call me, send me an email. We can talk, we can chat. I love coffee. I love lunches. Anytime that, again, if anyone needs additional information or just can't find anything, I can point you to the team. We have a great population health managers and those directors and staff, community health workers that really do a good job. Like, that's what they are there for. And again, you talk about meeting people where they are. Like, their job is, if the patient's not coming to the health center, they get in their car and they go to you. So if you pick up the phone and say, hey, I just don't feel like coming in today, can you come to my house and get me enrolled? That's what we're there for. We'll do it. So again. Thanks for what you do. And I'm happy to help in any type of way that I can.
Thank you for entertaining having this conversation.
Absolutely.
And to your point, this isn't it, right? This is just the beginning. And hopefully also, y'all, Transform 314, we can, help even beyond the Medicaid enrollment, having this conversation. But, we can see how we can partner to support one another, because like you said, it's about everyone. It's about us all. So how can we come together to make sure that we are serving the good of the people? That's what we're supposed to be doing.
Absolutely.
So shout out to you. before we close, I got my announcements like it's church, but it ain't church. But I have a couple announcements. Obviously, Thursday night, y'all, please come. Bait Restaurant, 6 p.m. It'll be great. Kicking it for cause. That's the official event title. So obviously, we'll be talking about this important topic. We're gonna have food, we're gonna have some music. And so what we do, if y'all haven't been to Kicking It for a Cause, we have this event every month. So obviously we talk about a topic that is really important. And we also provide calls to action, how we can individually and collectively address whatever issue we discuss. So we'll have some folks in the building, some heavy hitters. And then after we talk about the stuff and hey, this is what we need to do, we play a game now. We don't play spades because we don't do that because we ain't on that kind of time. And I do
Yeah.
serious. But we have some other fun games, and it again creates a space where people can really build camaraderie, network, all that. So please, y'all, Thursday, 6 p.m., Bait Restaurant on Lindell. I'll be sure to share the information as well so people can register so we know how many people come because we try to feed people. Another plug I have to say next week. Woo! Next week. So I'm so excited about this conversation. I was excited about this conversation, but next Monday we will have folks from We Power joining us talking about how they are working with community to ensure that we are included in development. So they got some things that they're doing. And they'll be speaking on our platform to share kind of what that's getting because I have a lot of conversations. There's a lot of cranes in the sky.
Right.
Especially in the city. So we'll be talking to them about ways, again, they're working with community to make sure that we ain't pushed out, but we are included in building up our community. So y'all, next week, same time, same place, 7 p.m. But I think I'm gonna see y'all on Thursday.
There you go.
Until then, y'all, please be safe out there, and I'll see you soon. Peace.
All right.